Chrissy Campbell, your mediator for this segment of Rattler Health Nation. For this segment, we will discuss racial and ethnic disparities and their relationships. We're joined today with Jasmine Devanin, a graduating senior in the field of pre-physical therapy. Christina Marshall, a graduating senior student in pre-occupational therapy. We want to welcome Joy Williams, a graduating senior in the health science. And last but not least, we have Khadijah Townsend, a graduating senior in health science. First, we have Jasmine Devanin with an overview of what to expect in today's segment.
Good evening, Rattlers. I am Jasmine Devanin, and I'm here with the summary for today's segment. First, we will be talking about health disparities. Healthcare disparities refer to the differences in access or availability of facilities and services. Health status disparities refer to the variation in rates of diseases, occurrence, and disability between socioeconomic and/or geographically defined population groups. Our next topic is the Affordable Care Act. The Patient Protection and Affordable Care Act, also nicknamed Obamacare, is a United States federal statute enacted by the 111th United States Congress and signed into law by President Barack Obama on March 23, 2010. Under the act, hospitals and primary physicians would transform their practices financially, technologically, and clinically to drive better health outcomes, lower costs, and improve their methods of distribution and accessibility. The case we will be discussing today is Zubik versus Burwell. In 2010, Congress passed the Affordable Care Act, which requires group health plans and health insurance companies offering health plans to provide preventative care and screenings for women pursuant to the guidelines established by the Department of Health and Human Services. The petitioners are religious organizations that argue that the contraceptive coverage mandate of the ACA violates the Religious Freedom Restoration Act, which Congress enacted in 1993 because the mandate requires these organizations to facilitate the provisions of insurance coverage for contraceptive services that they oppose on religious grounds. The next topic is our Iron Triangle. The concept of the Iron Triangle of healthcare describes three competing healthcare issues: access, quality, and cost containment. Each of these vertices represent identical priorities. Increasing or decreasing one results in change to one or both of the other two. For example, a policy that increases access to health services would lower quality for healthcare and/or increase costs. The desired state of the triangle, high access and quality with low costs, represents value in the healthcare system. Now back to you, Chrissy.
Christina Marshall, what are your thoughts on health disparities and the Affordable Care Act?
A health disparity refers to the high burden of illness, injury, disability, or mortality experienced by one population group relative to another. A healthcare disparity typically refers to the differences between groups in health insurance coverage, access to use of care, and quality care. What contributes to the disparities within health and healthcare are environmental, individual, provider, societal, health, and system factors. Individual factors consist of eating and living a healthy lifestyle, following doctor's orders when presented with any health issues. Provider includes cultural and linguistic barriers to patient-provider communication. What shapes these disparities in how healthcare is organized, financed, and delivered, as well as contributing to the factors of society and environment, poverty, education, and neighborhood safety. Shape the disparities of today's health and healthcare system. Disparities not only affect certain groups, it occurs amongst most attributes such as race, ethnicity, economic status, age, gender, disability, as well as sexual orientation. Nonetheless, it also affects the overall improvement of the quality of care. Today, many are at risk of being uninsured, without any access to health care, and are experiencing a plethora of health issues. The population in the world is ever so growing, and by 2045, it is expected that the world becomes more diverse, and people of color are projected to be amongst those who account for over half the population. African American, Hispanics, American Indian, and lower income based individuals will be uninsured. Of those with color and low income are expected to face increased barriers to accessing healthcare, poor quality care, as well as worse health issues. The Department of Health and Human Services Disparities Action Plan sets out a series of priorities, strategies, actions, and goals to achieve a vision of a nation free of disparities in health and healthcare. The Affordable Care Act increases coverage options for low and moderate income populations, includes other provisions to address disparities. The Affordable Care Act provides Americans with affordable, comprehensive health care. Passed in 2010, the Affordable Care Act now provides Americans new opportunities to affordable, high-quality, comprehensive health care coverage, gives minorities financial protections if you face severe illness, those who have pre-existing health conditions. Children may be covered under their parents' insurance plan until the age of 26. Insurances cannot charge higher premiums if you're a woman. And lastly, insurers cannot sell substandard plans that won't pay for essential health care benefits. Americans can now be insured with quality health coverage for the first time for some in their lives. Back to you, Chrissy.
Joy Williams, what do you think of the Zubik versus Burwell case, and what is the relationship between that and health disparities?
Hello everyone, my name is Joy Williams, and I'll be here discussing the Zubik versus Burwell case and how it correlates with health disparities. To begin, there are disparities within every aspect of life in the world today, with the most profound being in healthcare. As defined by the World Health Organization, health disparities are variations in healthcare received by distinct groups that are unfair yet are avoidable. Quite simply put, everyone does not receive the same quality of care nor have equal access to the health care as compared to others, which is unjust. The sources of said disparities are ingrained in this nation's broken health system, and this coincides with women along with minorities having the greatest likelihood in experiencing these differences. There are differences in the way healthcare is utilized based on gender. Women are more susceptible to health problems, but also have less control over their health care, one factor being lack of access. For example, men tend to make little use of available health services less than women, which of whom require these health services more. Available health services include things such as checkups and or preventative services that women have a greater need for. Specifically, women need reproductive services, which are at times reduced because of politics and or laws. This disparity is quite evident in the cases of Zubik versus Burwell and Hobby Lobby versus Burwell, in which certain religious organizations challenged the requirement put in place by the Affordable Care Act to provide contraceptives as a preventative method for women. In this case, civil rights laws were put into question by allowing the religious convictions of the objectors to supersede medical needs of the female employees. The objectors were referencing the Religious Freedom Restoration Act as a means of justification to violate women's rights. The fact that the need of contraceptives is being challenged demonstrates how potential access to this service has a role in enabling factors that include finances, more specifically insurance. Contraceptive methods like birth control were rendered to be free due to the ACA, which is yet another benefit being taken away from women that correlates with access. Potential access reflects the use of healthcare, which includes aspects like the knowledge of availability of health insurance along with the ability to afford it. Generally, individuals rely on their employers to provide insurance and cover costs. Thus, with these challenges presented in these cases, it will further add to the disparities in healthcare by affecting economic access and availability. It is mandatory for Americans to begin to realize women have unique healthcare needs and therefore require special focus. With existing analysis such as the National Healthcare Quality and the National Healthcare Disparities Report, the government should be able to identify these gender inequalities quantitatively, yet it is a continuous problem. Through the case of Zubik versus Burwell, it is apparent that the system in which we reside is patriarchal And with that, unnecessary disparities in healthcare will remain for women. Back to you, Chris Hayes.
Khadijah Townsend, what are your thoughts on the Iron Triangle and how does it tie in with health disparities?
The Iron Triangle is used when referencing healthcare policy. It represents three components: access, cost, and quality, which influence how the public receives healthcare. This concept is used to illustrate how there are naturally trade-offs that occur within healthcare policy. If you can improve one or even two of the components, it will come at the cost of the third. Ideally, we want to increase access and improve the quality of healthcare while decreasing the cost. How is this possible? Well, if we are looking at the history of this country, it isn't. Preventative healthcare such as regular doctor's visits, checkups, and exams have only been available to those that have insurance or can afford to pay for these things out of pocket. In the past, the insurance market wasn't regulated, allowing insurance companies to charge high premiums and deny coverage to whomever they see fit. So how do individuals without insurance or the money to pay receive preventative care? To answer this, they simply don't. These individuals have to use the emergency room as their primary source of health care. This cycle forces those in the lower economic class to wait until they are extremely ill to receive any form of healthcare services. In order to increase access, we must make healthcare available to everyone, and in order to improve quality, we must train healthcare providers to treat each patient as significant and not just another number. Decreasing costs is one of the more difficult tasks because no one wants to provide any services for free. However, healthcare isn't like other services because at some point every person will need some form of healthcare. All three of these components are equally important in making healthcare better and available to everyone. But what is the perfect balance that decreases health disparities in this country? Back to you, Chrissy.
Okay, we will have to end it there. But thank you guys for watching, and till next time, stay healthy.